All right, everyone, we will get started in just a moment. We have gone live and it looks like we have people signing in, so that is wonderful. And we will get started in just a moment, everyone. Thank you for your patience. All right, we are all set and ready to go. Thank you for everyone in attendance today. We truly appreciate it. And welcome to our very first Power to Inspire virtual series. With the COVID-19 virus shutting everything down, we are coming up with new ways to engage with our audience, which we very much miss doing. So with that said, let's meet the people who will be speaking today. First up, we have Terence Lester, the founder of Love Beyond Walls. Terence is a speaker, activist, author, and thought leader in the realm of systematic poverty. He's known for nationwide campaigns that bring awareness to issues surrounding homelessness, poverty, and economic inequality. I will be your leader of this discussion today, and I am the Senior Manager of Public Engagement at the National Center for Civil and Human Rights. And our last panelist is April Ballard. She is a public health researcher who focuses on water, sanitation, and hygiene among people experiencing homelessness in the United States. She has her Master's of Public Health in Epidemiology and Environmental Health from the University of Kentucky, and is currently working on her PhD at Rollins School of Public Health at Emory University in Environmental Health Sciences. So we are very excited to have this panel here today. And without further ado, let's get started. So first, good morning, panelists. It's great to see you.
Yeah,
and
it's great to be here. Thank you for having us.
Oh,
Yeah,
thank you for being here. So first, with COVID-19 going around, how are you guys doing and how are your families?
Do you want to start, Terrence, or do you want me to?
It doesn't. I guess I can start. The pandemic in itself has, I guess, increased anxiety for me and my family personally. My kids are constantly asking, "Hey, when are we going back to school?" They're younger and they're still trying to figure out what this means, what a pandemic is, and what it means to not only our family but the rest of the world. But for the most part, we're standing strong. I think this pause has given us an opportunity to reinforce our love for one another. And I've been, chipping in with homeschooling, in which I just resigned. I put in my 2 weeks notice this week.
Yeah, so my situation's a little bit different. All of my family lives in Kentucky, and then obviously I live here in Atlanta. And so my family is doing great. My sister works in healthcare, so is obviously considered essential personnel and is on the front lines of kind of things. And I'm here just working remotely and trying to stay at home as much as possible, but definitely still adjusting to virtual life. I think I spend most of my day on Zoom.
Yes, the Zoom platform, I think, is becoming part of the lexicon much more rapidly than I think even they would have expected. And speaking of one of the Zoom features, if anyone has a question in our audience, feel free to click on the Q&A and we will try to get some of those questions answered at the end. But to begin, I have a few questions for everyone. And Terence, we'll start with you. Could you tell us a little bit about your organization, Love Beyond Walls, and the Dignity Museum?
Yeah, sure. So Love Beyond Walls is an organization that's focused on affirming the dignity of people experiencing homelessness and poverty. We do that in a number of ways, providing education to the general public, but also building intentional relationships with people going through the experience as a way of helping them to achieve self-sufficiency. And so we've been doing this work for about 6 years. about 5 years into the work, we started to field a lot of questions from our volunteers. What is it really like, or what does it really mean to go through the experience of homelessness? And me being a person that had experienced it in my younger years as a teenager, I wanted to create a space that would help people immerse themselves into the realities, but also use it as a space to strip the microphone from the persons who control the dominant narrative of what it means to be a person going through this experience. And so we created the Dignity Museum. It's the first museum in the United States of America that represents the subject of homelessness. And basically, we use this museum as a vehicle to amplify the various stories of people that go through this plight, to deconstruct the generalizations and the false narratives that persist about people experiencing homelessness. And so this work has been used to educate high school students, college students, professors, also working with law enforcement individuals who are wanting to go through empathetic training. But we've also recently partnered with the National Center for Civil and Human Rights, which has been really great to be able to advocate and get this important information out, because everybody arrives in the experience of homelessness from different ways, and we want to make sure that we are affirming those ways and honoring the voices of the individuals that actually have to live this out every day.
Yes, and for anyone who has not seen the truncated exhibition outside of the National Center for Civil and Human Rights, if you're around downtown Atlanta, come take a walk by and check it out. Make sure you're keeping your proper social distancing going, but it's a really great exhibition, and I highly recommend it. Now, April, could you tell us a little bit about the nature of your work in your PhD studies?
Yeah, of course. So I am a native from Kentucky and moved to Atlanta in 2018. And prior to moving here, my primary focus in my public health work was on water, sanitation, and hygiene. Sanitation being mainly bathrooms, but for the most part, that sector focuses internationally. And so I took a little kind of side route before starting my PhD and was working with people who use drugs in Kentucky, particularly in Appalachia, kind of in the midst of the opioid crisis. Kentucky, Appalachian Kentucky particularly, was hit really hard. And so in my work, I saw quite a drastic amount of people who were experiencing homelessness, and I felt like people weren't talking about this. And then in my transition to Atlanta, obviously, homelessness is a lot more visible in urban areas, and we see people out and about more. And I just kind of couldn't stop thinking about, if we're seeing these inequities in other countries related to water, sanitation, and hygiene, this is an issue in the US as well. And I think, you know, people often point to things such as Flint, Michigan as an example of that, but we don't have to look at those sorts of extreme cases. We can look right outside our doors and see that, you know, the people there are experiencing issues with this. So I'm still in the early stages of that work, and a lot of other researchers and public health professionals are looking into that. The CDC has recently made homelessness a priority for them as well. And so things are starting, but they're still, again, in this very initial phase. And so I've done a little bit of work mainly in rural areas as well as among women, particularly because they're another vulnerable subpopulation of the overall population of people experiencing homelessness. But I mainly focus on barriers to access, or what types of access people have and the issues with the quality of that access, and thinking through ways in which we can meet those basic water, sanitation, and hygiene needs for this population.
And that is a wonderful lead-in to the work that Terrence is doing. So Terrence, what are barriers that may not be considered by those who have consistent access to shelter, and compared to those who are houseless during perilous and uncertain times like these with the COVID-19 virus?
Yeah, that's a great question. I think about 2 weeks ago, we started to have a lot of our community members express their deep concerns and fear for contracting the coronavirus. And every time that we would ask them what was at the base of that fear, they would start saying, well, I'm afraid because I can't wash my hands. I don't have any access to running water. And it made me think about all of the shutdowns that were happening in terms of restaurants and public spaces like libraries, places that people experiencing homelessness oftentimes frequent, just as a addition or additive to their basic necessities for survival. And for me, it started me to think about how could we adequately get access to water and soap to individuals actually living on the streets, because it's my belief that soap and water is a basic human right, that sanitation is a basic human right. And so with the help of our community members, we started to look at how people use RVing or camping in terms of like using porta potties and portable hand washing stations just for like basic camping needs. And so we had this idea to take a feature that is oftentimes used for our RVs to actually use that as a vehicle to transport water and soap and hand sanitizer to individuals living on the streets. We started doing also research that there wasn't anything being done in terms of disseminating water and these basic necessities to people living on the streets, so they can also protect themselves against the coronavirus, which the media was suggesting that hand washing was one of the most important ways.
That is an incredibly creative solution to that problem. Um, that's incredible work.
Yeah. So far, we have about 30 stations that we're rotating around the city of Atlanta. We just went out early this morning. Every time we go out and we refresh the water and we sanitize the station, there's a line of individuals that are literally waiting to wash their hands. Another thing too is there's a gap in information, right? When you're living on the streets, you don't have access to information if you don't have a cell phone or if you aren't able to go to a public library. And so we've had to do a lot of educating people as well about what the coronavirus is and how it can impact them.
That's great. Just out of curiosity, how often do you guys aim to refresh the water in those stations?
Yeah. So right now we're going out every single day. We have a small group of people who are committed to this work, adhering to the less than 10 rule nationally and in the cities. And so we've been committed to going out every single morning, making sure the stations are sanitized and wiped down, and also refreshing the water. But most importantly, just having conversations with individuals has been a huge deal in terms of spreading hope. Like this morning, we had an individual that we were talking to. He had taken a napkin and two rubber bands and literally created his own mask. The ingenuity and creativity. And he said that he normally doesn't worry, but he had to figure out a way to create this mask just to keep himself protected, because a lot of his friends have been disappearing. So, yeah.
Oh my goodness. April, would you mind discussing what the unique challenges are for people experiencing homelessness when considering the COVID-19 public health interventions, as well as how is this different from barriers?
Yeah, so when thinking about the unique challenges related to COVID and people experiencing homelessness, there are kind of a couple considerations, and Terrence hit on, you know, most of them, but through education and health literacy is a really important challenge that we think through, you know, when we're trying to help people prevent this and the spread of this. So we need to consider the messaging that we're using. So the term social distancing is difficult for a lot of people to understand. And it's also just not feasible in a lot of circumstances. So if you're thinking, you know, I think Terrence hit on a really good point earlier that homelessness looks different for a lot of different people. And so that means maybe you're living on the street, maybe you're living in the woods, maybe you're at a shelter, maybe you're living between places, between family members' places. And so all of those things need to be considered. And when we say social distancing, we need to understand that that is not the reality that everyone can actually implement. So that's one piece. Another piece Terrence's initiative really hits is that when we're encouraging things like hand washing, we need to be able to make sure that people can actually perform those behaviors. And so it's really unethical to tell someone to wash their hands if they can't actually wash their hands. And so not only telling people which behaviors to perform, but giving them the resources to perform that. And I think Terrence's initiative is a really great example of how we can all work together to make sure that what is the best protection is available for all populations. How we're communicating it, another piece that Terrence touched on, speaking about gaps, is the way in which we communicate this. So for populations that are houseless, you know, putting it on the news isn't always the best option. And so we might need people on the ground actually going out, spreading the word, showing people how to wash their hands, and also explaining the signs and symptoms so that people know who to stay away from, what to do in the case that they need to kind of self-isolate, how they can do that, what the resources are available. I think another really important piece of this is all the other unintended consequences. So especially in a lot of places are considering early release to de-densify or like kind of reduce the density of populations that are incarcerated, which I think is warranted given this is a respiratory disease. But we also need to make sure that people are equipped and that we're not releasing people out and creating a greater number of people who are experiencing homelessness. And also overdosing related to substance use can also become an issue in that case. So ensuring that we have adequate supply of naloxone and resources for people.
Excellent.
Yeah,
And
I was going to say that's a really great point, April, about social distancing. I've been, you know, really challenging people to reframe what they mean by social distancing, because that's not really what we're talking about, because social distancing speaks to social isolation. And what we're asking people to do is be physically distant, but we're also encouraging people to stay connected socially. Hence, this is why we're on, you know, Zoom having this session right now, because we're trying to create an avenue for people to maintain that social connection. Another thing that I like to point out is that people experiencing homelessness have been dealing with social distancing long before the coronavirus. And so the reality is that we have paused long enough to see the dire need for us to pay attention to a community of people that have been invisible. And the other thing I would say that I love that April just brought up is that we do need to care about the entire community, the whole community, not just parts of the community in silos.
yes, I think that's an easy thing to get sucked into as you start focusing on yourself and your own family. It's very easy to forget about those people who have been invisible to us, and we do run the risk of them becoming more invisible as this goes on. So the work that you two are doing is vital. to their human rights and humanity. And I'm sure that people are going to be inspired by the work that both of you have been doing. Do you have any advice for our audience for looking for specific ways to advocate for these issues during uncertain times?
You want to start, April?
So there was actually a really great article that I can somehow get the link while we're on here to share, that came out from Atlanta's NPR station, that actually provided, including Terrence's initiative, but provided ways to get involved, not only with people experiencing homelessness, but just in general, which I think this is a great call to action for all of us in this time to contribute to ways that we can, whether that be financially, with time, things like this via Zoom, checking in on your neighbor, whatever that is. And so I think, you know, specifically thinking about this issue, I think one thing is just considering that having compassion for people that are in this situation, because a lot of the time, maybe you don't think about this all the time, but I think the first step in kind of tackling this issue is just literally thinking about it, and thinking, kind of deconstructing the types of preconceived notions or implicit bias that people have, that people who are experiencing homelessness look a certain way or are in a certain situation. That is false, and this can impact anyone. And so I think that initial conversation and deconstruction of those biases is step one. Step two is partnering with local organizations. Terrence's initiative is a really great example, and I'm sure he'll highlight that. But whether you can, you know, financially contribute to those right now, because a lot of things are not, you know, we're social distancing, so a lot of places aren't taking physical volunteering right now. But being able to give back in those other ways is really important. And, you know, if you're comfortable and you can give like hand sanitizer, soap, water, you don't have to approach people, but you can leave that in certain locations that I'm sure Terrence has a really good knowledge of where you can put those things so that people can find them. I think that those are really tangible, easy things that we can all do right now. And I'll let Terrence speak a little bit more about those.
Yeah, those are great points. You know, the being intentional with your time. One of my friends has really advocated for people to actually create a schedule, and within the context of that schedule, including blocks of time where you are intentionally checking on people, or you may lend your skills or talents to serve an organization. Like our center also has elderly people that visit frequently, and we have volunteers right now that have gotten their numbers, and they're just doing regular checkups in terms of calling, asking them, are they okay? Is there anything that is needed? And you'll be amazed at the number of needs that are discovered just from a phone call. We have also volunteers, April brought up, in like disseminating those basic necessities in terms of like prevention supplies, in terms of like hand sanitizer, cases of water, soap. And you have to think about when people are experiencing homelessness, a lot of them depend on the community of commuters, right? A lot of them have forged relationships with individuals who drive back and forth to work. And in speaking with individuals right now, they'll say, you know, I miss so-and-so. I used to see her every day driving to work, and she would, you know, have a hygiene bag for me. Or I miss so-and-so. We used to eat lunch together. So there's also like this very loneliness that is compounded with the social distancing that people experiencing homelessness have. And so like if you're in a place where you want to drop off those prevention supplies, I would highly recommend parks. There are a lot of parks downtown where you could just sit those supplies on like the public benches where you know people will be, where they can have access to that. And another thing too is like, I'm really big on education, and I know April is as well. There's so many articles out there right now surrounding this particular subject. I would just educate, and also use your social platform to educate other people. I know we've seen a lot of messaging go out now that is very gloom and doom, right? But we also need to put messaging out in the world of like practical ways that we can support each other, but also advocate on behalf of a community that is invisible.
Excellent. I'm seeing a few of the questions popping up from the audience, and I'd like to do at least a few of them. And one that I see is, what is the city of Atlanta doing to help protect people without shelter from this virus? Terrence, you might have a better idea than me, certainly.
The mayor was on the news last night, and she outlined the six things that the city has begun to do. I think she also mentioned that there was an angel donor that just donated a hotel in the heart of the city for people who have either been tested positive for the coronavirus, and so they're going to use this space to like isolate people for recovery. Another initiative too that the city is involved in is outreach in terms of education. So I think there are some other organizations out there on the streets educating people, and that's pretty much a lot of what I've seen and what I've heard communicated. What about you, April?
Yeah, I know that the CDC is also working with the shelters to ensure that they're equipped with information and practices to be able to prevent the spread. So the CDC has a specific, they have specific guidelines for shelters and other organizations that serve groups that are focused on people experiencing homelessness. And so that was disseminated to those shelters, and there's been some webinars also that they've hosted, as well as the housing development from the actual national government to ensure that, you know, they're washing spaces properly, disinfecting those. They're spreading out beds to be 6 feet apart so that, you know, to reduce the risk of the spread, and having active conversations. So along with the actual initiatives out on the street and helping people who actually become infected, they're working with shelters to ensure that in typically crowded spaces that the risk of spread is reduced.
Great. And another question I see here, would you recommend that the Atlanta Police Department delay arrests for nonviolent crimes, similar to what Philadelphia is doing, as a way to prevent people from entering into the justice system during this time, as opposed to having to release people out of the jails?
I think we're both
April?
waiting for the other one to answer. Yeah, I mean, anything that we can do to reduce the density of the incarceration system right now is I think necessary. Similarly, I know, you know, the release of nonviolent offenders is a route that some states are looking to do, and I think that this question is kind of the answer to this question is in a similar vein. We need to focus on the health and well-being of everyone, and that includes not arresting people for nonviolent offenses, because that not only puts them at risk, but puts an entire community of other people at risk. And so thinking through, I really think that our approaches to this and our solutions to this have been very community oriented and coming from not only a place of personal well-being, but how can I ensure the well-being of all the people around me? And I think that that should be our approach. And to answer that question, then we should not be arresting people for nonviolent offenses.
Yeah, I would say I totally agree with everything April just said. I think one of the top priorities right now should be the focus of everybody's health and well-being. And I think that adds an extra layer of pressure for law enforcement as well. We have to consider their emotional stresses right now. There are a lot of people on the front lines doing this work while individuals are at home and physically distant from other people. And so we have to make sure that we preserve the health and the energy of people who are on the front lines.
That's excellent. Thank you both for that answer. That makes a lot of sense. Switching gears a little bit, with the portable hand washing stations, we had one attendee from the audience ask about how those are being cleaned, and is there any concern that if someone potentially has the virus and touches the station, is there a potential for spread there? So I think really what they're getting at is how are the stations, one, being cleaned, and just kind of specifically how they are aiding in the prevention of the virus?
Yeah, that's a great question. The stations are being cleaned and rotated on a daily basis. We pick the stations up, we take them back to our center. We clean them with chemicals, ensuring that we touch every single part of the station. We clean them with protective gear ourselves. I think one of the things that is helpful for the stations is just giving people, like I said before, the basic access to soap and water, which is a basic human right. You know, it's like right now I could get off my laptop and I can walk over to my sink and wash my hands, and that is a privilege that I have that people experiencing homelessness do not have. And it goes back to what April was saying earlier about the messaging. We can't communicate a message from the media or from leadership if we're not also providing the tools so people can perform those behaviors. And so what we're doing is ensuring that people actually have those tools and the information needed to educate themselves about the virus, but also to protect themselves by washing their hands.
I would just also add to Terrence's point that this virus is washing your hands is very effective to prevent this virus. Soap and water, hand sanitizer, alcohol-based cleaners, those are our best defense, along with obviously social distancing. And so that is a really great intervention that we can use among people who are experiencing homelessness to reduce their risk of spreading and contracting the virus. But also we can look back at other types of outbreaks and see that this was very effective. And specifically thinking about the hepatitis A outbreak that happened in the US throughout multiple states, including California and Kentucky, they used hand washing facilities and portable hand washing stations specifically among people who are experiencing homelessness, because that was one of the largest groups that were impacted by hepatitis A, which is a fecal oral transmission virus. And it's, again, you know, the hand washing is really critical. And so Terrence's initiative is kind of a proven intervention that works really well. And so they're doing all the right steps and gonna hopefully reduce the risk in Atlanta here.
Yeah, I really appreciate that. And April, for you know, that added research. One of the things that I will also like to communicate to people is that people experiencing homelessness are probably the most vulnerable right now and prone to contracting the coronavirus, in that there's no access to soap and water. Sometimes they are dwelling in places that have a lot of germs, and sanitation is not available to them. And also there are other factors, like they already have like other issues, maybe other health issues that they're battling with, like influenza, strep throat, hepatitis C, tuberculosis, and or other sicknesses or illnesses that they're faced with. And so our step has been calculated, but it's also been like in response to this crisis, right? It's like, what do we do in the moment where people who have been socially distanced long before the coronavirus have the proper tools and necessities they need in this moment? And so that's been our response.
That's actually a great lead into another question that just came up. It says, the COVID-19 pandemic is serving as a conversation catalyst around many issues. I think this is one of those, and I am encouraged to see and hear conversations happening on the local and national level about how to better protect and care for homeless populations. What are some things that you hope to see happen on the other side of this crisis?
Yeah. For one, I think it needs to be legislated, or an ordinance needs to be created that every single city that has residents that are houseless, we put out portable, permanent hand washing and stations, or some type of sanitation stations where people always have this access. That needs to be across the board. It needs to be a law. That we are to care for individuals in this way. And I also think it needs to open up more conversations about how we could utilize various spaces that are in metropolitan cities with higher concentrated populations that have wealth, to utilize excess buildings in the city for emergencies such as the one that we're faced with now. What about you, April?
I have probably many lofty goals post-COVID that I would love to see happen. But I think one, as the person who asked the question pointed out, like just starting conversations about this, because in my opinion, there aren't enough people that talk about it, or they're not talking about it in the right way, I guess, in my opinion. I think there's a lot of stigma that comes with experiencing homelessness that I hope to see turn around after this. And just that, as Terence pointed out, this view of water, sanitation, hygiene as a human right, I think is something that I would really like to see the US push forward. We, like a lot of other high-income countries, have a lot of laws and norms around, for example, bathroom use in public spaces that I would really like to see change. People should not be denied access to a bathroom because of the way that they look, or the way that they're housed or not housed, and their ability to patron an establishment. And so one major thing that I would love to see change is the way in which we provide access, or work through being able to allow everyone to use public facilities, whether they're a patron or not, and figuring out other touch points in communities where people can have access to these very much basic needs that allow them to just feel like they have dignity and are a human and are worthy, because a lot of the times this can be, it really can make someone question their self-worth, which I think approaching this from an empathy standpoint is really critical for all of us.
Wow, that was good. I'm so glad to meet you, April. Yeah. So like currently I'm doing my doctoral research on policy design, and how policy design impacts the social constructions and narratives that persist about this population of individuals. And so, like, one of the ways that I also would like to see us move forward is to really challenge these social constructions and false narratives that persist about this population. There have been laws right now over the last almost 6 to 10 years that have emerged across the United States criminalizing what it means to be houseless. There are ordinances right now where you can be arrested on the West Coast for living out of your car, right? There are ordinances where you can be arrested for having more than 2 bags with you or given a citation. There are ordinances right now where you can be cited for sharing a meal with someone or standing in a public space. And so a lot of these ordinances have created this criminal language in how we define what it means to be houseless in this country. And one of the things that I would like to see moving forward is, changing that language and pushing against those ordinances, as April just suggested, that dehumanize and strip people of their dignity.
Exactly. That seems to be going in the opposite direction of actually helping those experiencing homelessness or being without a house or a place to live. So that's wonderful that both of your advocacy work is really inspiring. So you mentioned some of these cities who are creating these ordinances to criminalize experience homelessness. Are there any cities around the United States that you could point to that are showing leadership in how to approach this issue?
Yeah, I think we're on the cusp of it, right? I can't really point to any cities specifically, but I think we are on the cusp of cities paying attention. And I think this pandemic is, one of the crisis moments that is causing us to reconsider. I've been in talks with a lot of public figures that are doing, public work and leading in their cities. And so there is talk around, rethinking ordinances and bringing them up before like city councils and stuff like that. So I am hopeful.
I think similarly, I can't necessarily point to a specific city as a whole that is addressing this in a comprehensive way, but we can look for a couple of different examples within a city of good initiatives that are happening that we can all leverage and hopefully expand. So specifically related to COVID-19, Boston has a lot of great things happening for people experiencing homelessness. They have triage tents set up specifically for this population that they can come if they're having symptoms. They have the best that they can, these outdoor tents where they can actually be quarantined if they are positive and have a safe space to be. And so I think their approach right now is one that is really great. And then California, who is obviously one of the states most impacted by this issue, they specifically related to water, sanitation, and hygiene have some good initiatives that we could all use and look to scale up, specifically similar to Terrence's initiative with portable hand washing stations, but they also have portable showers and bathrooms where people can, just take care of their basic needs, such as washing their body, washing their hands, using the bathroom. And so again, there's still issues in all of these cities related to ordinances, homelessness being policed and seen as illegal, people being seen as illegal. So no perfect example, but definitely ways that we can pull from all these different cities to hopefully move forward in a cohesive and more comprehensive way.
You mentioned the tents that they're setting up in Boston. Are there any initiatives similar to that for getting people tested here in Atlanta for COVID-19?
Not that I know of. I have been, I was actually just at the Georgia Department of Public Health on, what day was that? Wednesday. And testing is a little bit different here. I don't know exactly what other states are doing, but here you have to be ordered by a physician in order to receive a COVID-19 test. And we don't have anything, to my knowledge, set up specifically for people experiencing homelessness. Terrence, do you have any other information about that?
Yeah, it's a great question. I would definitely agree with what April just said, not to my knowledge, and we are still unclear as to who gets access to these tests. Um, you know, what population of people get access to these tests? You know, what is that process like? Or if anybody experiencing homelessness has even been tested, that hasn't been like public information as of yet. So we're still waiting.
All right. Final question for you. Do you have any words of hope or inspiration for those who may face challenges as they advocate for various issues?
Yes, your work is needed. This is not the end. This is a speed bump. We will get through this. You know, your voice matters. You never know who is watching you, who your words will impact, who your actions will impact. And I like to think about the one, you know, who is the one before you that you can continue to motivate and advocate for. Uh, and I also would challenge people to, you know, find balance, right? About what you digest and consume during this moment, because you know, every empath or a caring person or a person that wants to advocate on behalf of others also needs to make sure that they're providing themselves with oxygen, right? So I would reduce the amount of negative content that you're consuming, and try to find the good stories that are out there. Right now, my hero is in Philly. He's 7 years old, and he took $700 that he raised, and he's using that money to provide care packages for the elderly. Like, I'm trying to find the good stories because there are people in this world who are just like me and just like April and just like you, that are continuing to fight and see this as an opportunity of togetherness.
That makes me think of that Mr. Rogers quote. In times of when something's scary, always look for the helpers because there's always someone helping. April, do you have any thoughts of hope or inspiration?
Sure, yeah. Of course, yeah. I think that for me, I think a lot of people are scared right now. And as Terrence said, there's a lot of negative content that we could look at or point to. But I think I find a lot of hope in the ways in which people are taking community action and thinking, you know, every single person that is staying at home and doing their part in this social distancing to prevent the spread of this disease is doing something, right? Like, that is an action. Staying home is doing something. And so I think that type of initiative and that type of response really shows me a lot of hope in community action. And so if people are willing to stay home and homeschool their kids like Terrence is doing, and, you know, check on their neighbor, get groceries for people that are of a vulnerable population and can't go to the grocery store, like, all of those are acts of kindness and acts for the greater good. And so I think if we can continue these types of conversations as we move forward and post COVID-19, I find a lot of hope in that, and thinking through the ways in which we can creatively, collectively tackle challenges and issues such as the homelessness issue. So I find a lot of hope.
That
Well,
was well
thank you.
said.
Okay. Well, thank you
I was
both
just
so much for your time and being here today. from your undisclosed locations. But thank you again so much, and we hope to do something like this again with you soon. Before we head out, do you have a few things of upcoming events at the center or digitally? As April was mentioning, and as Terrence is doing, homeschooling kids is a very difficult thing right now. So the center is partnering with the Alliance Theater to do a book club of sorts. It's our Spark Lit Club for kids, and we're going to be covering the story Sit-In, how 4 friends stood up by sitting down. There'll be a musical component, and it should be a lot of fun. Again, want to thank Terrence and Love Beyond Walls and April for your time today. And I hope you enjoyed this. Feel free to email us for suggestions on how we can get better at this. This was our first run, but we're hoping to do a lot more, and we'd love to make it as a quality presentation as we possibly can. So thank you everyone who is in attendance. Thank you to our panelists, and stay safe.
Thank you.
Yeah, thank you.
Have a wonderful day, everyone.